Hello, everyone. Hi there. Thanks for making it into this room. I know we had a little bit of technical difficulties, but everyone who made it, I'm so glad you're here. My name is Amy Van Ness, and I'll be your host and moderator for this session. I'd like to begin by acknowledging the land on which McMaster University is located, which is the traditional territory of the Haudenosaunee and Anishinaabe nations, and within the lands protected by the Dish with One Spoon Wampum Belt. That wampum uses the symbolism of a dish to represent the territory and one spoon to represent that the people are to share the resources of the land and only take what they need. We seek a new relationship with the original peoples of this land, one based in honor and deep respect. May we be guided by love and right action as we transform our personal and institutional relationships with our Indigenous friends and neighbors. It is in this same spirit that I welcome all of you to our third of 3 town halls. Today's event is focused on self-care and self-compassion for healthcare providers to cope with the occupational stress during the pandemic. This event is supported by the Public Health Agency of Canada as part of their work to address PTSD and trauma in those most affected by COVID-19. In this town hall, we may discuss healthcare providers who have experienced challenges in their work and home life during the pandemic. There could be moments that are disturbing to you, and it's totally fine if you wish to excuse yourself from this event at any point. Additionally, if you require wellness support, there are a number of wonderful organizations ready to help. You can learn more about each from the links in the chat. Over the past 2.5 years, we've heard so much about the strain on the healthcare system and on healthcare providers due to the pandemic, and we owe a debt of gratitude to all the physicians, nurses, therapists, personal support workers, and public safety personnel who, despite facing incredible challenges in their daily work lives, still found the time and courage to talk to us and share their experience. This research project aims to shine a light on the impact that the pandemic has had on the mental health of all those healthcare providers who have given so much of themselves to the service of others and continue to do so. The evidence-based resources and tools we're offering to help build mental health literacy, support, and resiliency are our healthcare salute, our way of saying thank you so much for your service. One more thing, before we get into the meat and potatoes of today's topic, I wanted to let you know that there will be time for our experts to answer your questions towards the end of the hour. So to submit questions, you can use the Q&A function that's at the bottom of your screen, and they'll show up on my end of things when it comes time for the panel discussion. We've also just posted a code of conduct in the chat, so please let's all work together to ensure this remains a safe space for sharing and learning for everyone. So to begin our program today, we're going to watch a pre-recorded presentation by Moda Karam, who will join us live today as well. In the talk, she'll be diving into some findings from her recent research about self-care and self-compassion for healthcare providers during the pandemic. Moda is a clinical research assistant in the Trauma and Recovery Research Unit at McMaster University. She completed her undergraduate degree at McMaster in the Psychology, Neuroscience, and Behavior program with a mental health specialization and a minor in theater and film studies. Currently, she's the project coordinator of this ongoing Canada-wide project on moral injury. Thank you so much, Moda, for sharing or for contributing to the conversation today. And let's take a peek at the recording.
Hello, everyone. We'd like to thank you all for being here today. My name is Moda Karam, and on behalf of the Trauma and Recovery Research Unit at McMaster University, I'd like to share some of our research findings with you on healthcare providers' self-care and self-compassion during the COVID-19 pandemic. During the COVID-19 pandemic, healthcare providers have endured prolonged periods of heightened stress as well as exposure to potentially traumatic events. In times of distress, uncertainty, increased workloads, we want to know how healthcare providers have cared for themselves and their mental health during the COVID-19 pandemic. We conducted a research study out of the Trauma and Recovery Research Unit at McMaster University, where we invited healthcare providers from across Canada to share with us their experiences during the COVID-19 pandemic. This study had both an interview portion and a survey portion where we collected myriad data, some of which we'd like to share with you today. Today, we're going to take a deeper look into how healthcare providers have coped with stress during the pandemic and whether healthcare providers have demonstrated self-compassion towards themselves. With the interview portion of our study, we were able to hear firsthand the experiences of healthcare providers during the COVID-19 pandemic. Healthcare providers were asked a series of questions related to various mental health challenges and impacts they've encountered. Today, we hope to magnify the perspectives of healthcare providers when asked the following question. Some people use various types of coping strategies when they're experiencing stressful situations. Have you used any particular strategies to help you cope? Here we have the data from 48 out of the 51 participants who provided demographic information. As illustrated by the data here, participants were mainly female respiratory therapists residing in Ontario. Results from our study revealed two overarching themes, each with two subthemes. I'll begin with our first theme here, shifting approaches to coping. So overall, from what we've heard from healthcare providers, there seems to have been a constant shift in how healthcare providers approach their choices of coping strategies. As we will talk about in the second theme, these approaches were often influenced by changing barriers and differing waves of the pandemic. Ultimately, healthcare providers navigated their way through coping with the challenges they faced on a day-to-day basis in an attempt to find out what works best for them and their own mental health. In this quote, this healthcare provider had initially turned to the use of alcohol as a coping strategy, but decided to seek professional advice and ultimately turned to meditation and a useful sleep routine. On the one hand, healthcare providers describe this feeling of being able to make an intentional effort to cope and improve their mental health in a way that they perceive to be healthy, positive, and effective in reducing stress, both short-term and long-term. This healthcare provider spoke about strategies such as yoga, therapy, and meditation, where they described them as methods for self-care, ultimately creating a positive impact on the individual's life, where they describe these behaviors they will carry on past the pandemic. Towards the other side of these approaches to decision-making, some healthcare providers sought out coping strategies that were lower effort and easily accessible, often due to the lack of bandwidth or capacity to make an intentional effort. Importantly, healthcare providers describe these strategies as negative or unhealthy, yet continue to use them as they still provided that desired result of distraction, relaxation, numbing out physical and emotional stress, and avoiding having to process their emotions. Examples from this quote here included alcohol use and binge eating, viewed as a temporary solution, ultimately creating feelings of guilt. On to the second overarching theme from the experiences shared by healthcare providers. Many described a range of barriers that impeded upon their usual ways of coping to manage work-related stress. First, we have pandemic-related restrictions, where healthcare providers reported an inability to access their usual or desired coping strategies due to government-level policies that were put in place that apply to everybody. This included various closures and limits on social gatherings. As illustrated by these quotes, healthcare providers would describe these strategies as being not allowed or that they can't do what they normally would do to support their mental health. And then we have these circumstantial barriers where various circumstances of the individual influence their ability to engage coping strategies to reduce stress. These circumstances were specific to the healthcare provider and their own individual experiences, and included various barriers such as seasonal changes, exhaustion, lack of motivation, and a key aspect of perceived impacts on family and friend relationships. Here, there were a few factors at play where healthcare providers described that they would refrain from seeking social support from family and friends as they were fearful of traumatizing them with their experiences, feeling like a burden to their loved ones, that their loved ones wouldn't truly understand, and that oftentimes they wouldn't want to engage in conversations about political views on vaccines and masks. So now we'd like to turn our attention to the topic of self-compassion, what it means to be self-compassionate, and how we can measure self-compassion in individuals. Self-compassion is demonstrated through behaviors and thoughts one has towards himself. It is when one is open and moved by their own suffering, caring, kind, understanding, and non-judgmental to themselves and their inadequacies, and recognize their own experiences as part of the common human experience. So by looking at self-compassionate behaviors, we can understand one's responses to pain and failure, one's predicament, and how one pays attention to their own suffering. Here we have some quotes from healthcare providers in our study where they've touched on various aspects of self-compassion in ways in which we will discuss shortly. As highlighted in blue, we see phrases such as, "We're all going through the same thing." "It's hard to ask for help when you feel that maybe someone else or there are other people that are more deserving of the help." "I try to have compassion about the situation," and words such as permission and guilt. There are essentially two ends to each measure of self-compassion, according to Kristin Neff, whom is an expert in the field of compassion and self-compassion. Here we have a positive pole where behaviors are compassionate and a negative pole where behaviors are uncompassionate. In this first column, we have self-kindness and self-judgment. Self-kindness refers to the gentle and understanding attitude towards oneself and expressing unconditional acceptance towards oneself. Self-judgment, on the other hand, refers to the harsh judgment of oneself for shortcomings. In the second column, common humanity speaks to the notion that all humans fail or make mistakes and no one person can lead a perfect life. On the other hand, isolation is when one feels isolated by their imperfections, as if they are the only one who failed or is suffering. In the final column, mindfulness is being aware of one's suffering experience in the moment and seeing it with clarity. On the other hand, over-identified is having an exaggerated storyline of the negative aspects of self. Today, we'd like to share the results from this self-compassion questionnaire from healthcare providers across Canada who participated in the survey. So 426 participants completed the self-compassion scale in the survey portion of our study. Of note, participants were mainly female nurses residing in Ontario. So healthcare providers scored similarly on scales aimed to measure self-compassion as scales aimed to measure negative self-compassion. And this was similar across all professions. The overall results indicate moderate levels of self-compassion. Further, looking at how self-compassion scores compared with other measures in our study, preliminary findings reveal a potential relationship between self-compassion and resiliency and self-compassion and emotion regulation. Specifically, data show a significant positive correlation between self-compassion and resiliency. So here, where participants scored higher on self-compassion, they also scored higher on resiliency. Also, data showed a significant negative correlation between self-compassion and difficulties in emotion regulation, where participants who scored higher on self-compassion scale also scored lower on the difficulties in emotion regulation scale. So overall, and in summary today, healthcare providers have struggled to engage in usual coping strategies due to various COVID-19 related barriers. And we saw here that healthcare providers fluctuated between an intentional effort and a quick fix decision, influenced by various factors, including closures, circumstantial barriers, and differing waves of the pandemic. So we see here that there is an urgent need to develop supports and resources for healthcare providers to cope with occupational stress and the unique psychological burden of the COVID-19 pandemic to improve mental health outcomes. And we also saw with these moderate self-compassion scores that they point to the necessity to understand how we can support healthcare providers by not only providing coping tools, but addressing various factors impacting mental health and the ability to seek coping strategies. Thank you all so much for being here today and allowing me to share with you some of our important findings from our research. These were our references for today. And we'd like to also thank our collaborators and supporters.
Thank you so much for sharing your research, Moda. It's clear that there's a real need for resources to be developed to help healthcare providers who have just like given once more to cope with their work during the pandemic. So let's develop some ideas right here. I'd like to invite a few more people to the table to continue this discussion and get into like the nitty-gritty of how to integrate self-compassion into our lives. So welcome to this digital room, Kim Ritchie, Hugo Shilka, Margaret McKinnon, and Moda Karam. I see you all coming in. Hello. Hi, folks. Okay, so we've already met Mona, but for the rest of you, I was hoping you could each take a moment to introduce yourselves and tell us a bit about your role as it relates to our topic today. Margaret, do you mind if we start with you?
So much, Amy. So my name is Margaret McKinnon. I'm the Homewood Chair in Mental Health and Trauma, and I'm also a professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster. My trade is, as we say in the military work we do, is I'm a clinical psychologist and clinical neuropsychologist. And I have had the privilege of serving on the front lines of the pandemic, so spending time rather in the hospitals, providing supports to staff on COVID units and ICU units.
Thank you, Margaret. And what about you, Hugo?
Hello, everyone. My name is Hugo Schilke. I'm the Trauma Services Development Lead for Homewood Health, also a clinical psychologist specialized in helping people with trauma, dissociative disorders. I guess my relationship to this topic is that without self-compassion, you really aren't able to allow yourself to give yourself the care you need. And so that's what we'll be talking about today.
Thank you, Hugo. And Kim, would you like to introduce yourself?
Hi, everyone. My name's Kim Ritchie, and I'm an assistant professor at Trent University, and I also hold an adjunct position at McMaster University in the Department of Psychiatry and Behavioral Neurosciences with this lab. I'm also, my background is I'm a registered nurse and primarily in mental health.
Thank you, Kim, and welcome everyone again. So Hugo, I'd love to start with you. And I'd really love to start by grounding us all in this room in a shared understanding of the topic we're going to talk about today. So my big question, and I think probably a question for the audience, is there a difference between self-compassion and self-care?
That is such a good question. And the short answer is yes. The longer answer is that, again, I guess in some ways I already spoke to this, that it is very, very, very difficult to give yourself the care you need if you aren't being fair and gentle and kind and compassionate with yourself. And so each of those words is different ways of saying compassionate, right? So being fair is another way of being compassionate, right? So making sure you're not judging yourself overly harshly, which is what we tend to do in this culture and these cultures. We've learned that to make changes, we need to judge ourselves harshly, when in fact the opposite is true when you look at the research. And so lots more I can say about this, but the short answer to your question is yes. So self-care is giving yourself the care you need. And what allows us to do that is to relate to ourselves in a compassionate way, right? To be gentle with ourselves, to be interested in what's going on, to validate what's valid, and have an easy manner with ourselves, and encouraging ourselves to give ourselves that care when we need it.
Okay, wonderful. So self-compassion, the compassion is like the feeling and the desire to treat yourself, and the self-care are the actions that you take. Would that be right? Yeah. Okay, great.
We think of that as like the how and the what, right? So self-compassion is how you relate to yourself, and the self-care is what you do to take care of yourself.
Excellent, excellent. Okay, thank you. Mona, I'd love to know, thank you so much again for sharing your research. I'd love to know what the most sort of surprising or insightful outcome of that research was for you.
Yeah, thank you, Amy. I think, ultimately having the privilege of listening to healthcare providers' experiences and kind of being that point of contact between what's happening on the front lines and how we can play a role in helping, I think has all kind of been truly insightful. Most specifically, I guess what resonated with me was that for healthcare providers who kind of turn to those quick fix strategies that I talked about in the presentation that were perceived to be unhealthy, or that those who struggle to cope to reduce their stress, it wasn't necessarily that perhaps healthcare providers didn't want to cope or didn't want to put in that additional effort to support their mental health, because many healthcare providers expressed a desire to cope and even mentioned that if they had perhaps had more benefits or more bandwidth, that some desired strategies would have been more accessible. And although it may not seem like this at first glance, speaking sort of on behalf of the research point of view, it allows us to kind of see and hear from healthcare providers what they need to cope so that we can find ways to help reduce that burden of having to use rest time and extra energy to kind of, scramble seeking what's available. And, you'll kind of hear some of these strategies today from us to kind of combat these barriers and ease the process of self-care and coping so that it isn't this unachievable for healthcare providers to be able to care for themselves and their mental health.
Yeah, wonderful. Thank you. Thank you for saying that. That kind of segues perfectly into my next my next question, which is, in that presentation, we learned about these quick fixes, right? The examples that were shared were alcohol, binge eating, because they provide that desired stress relief in the, small amount of time that we know healthcare providers have to focus on themselves. So Hugo, I'm wondering, so these quick fixes strategies also mentioned sort of end up in a residual feeling of guilt. So my question is, how can healthcare providers begin to work past that guilt?
Such a good and really important question, right? So if we look at, maybe part of it is the way I think about this is that self-understanding enables self-compassion, which then enables compassionate action, right? So it's actually 3 steps. Sometimes people think I just need to do this thing, but to get there is actually lots of steps, and easiest broken down into 3. And so how do they get past that guilt towards that compassionate action? So the first part is a fair self-understanding, that it makes so much sense that when you're overwhelmed, you reach to the things that have helped even a little bit, even just for a short period of time, because at least it's some form of relief. So it's about having, again, a fair relationship with yourself, not shaming yourself for doing the best you know how so far, right? And then the next piece is knowing that it is also really hard to change how you give yourself the care you need, and from a quick fix to something that is something that helps for a longer period of time, but might take longer to help you to get into that routine of doing that, and also for it to feel those effects, right? So it's knowing that you have to give up something to kind of work towards something. And that also means, number 1, knowing what those other things are, 2, trusting that they'll work enough to want to practice them, then 3, practicing them usually when you don't need them, so that you're more able to do it when you really need to rely on that skill. And then it's really during those times when you're really struggling, again, being gentle with yourself. It's sometimes I think about this as like giving yourself the care you need. And there's an acronym, one part I borrow from DBT, one part developed to help trauma patients. So the first letter is G. So to give yourself the care you need. So G, being gentle with yourself. This is all the how. Gentle with yourself. I is interested in why you might be feeling this way, and what you might be missing, right? Or what might change how you feel if you noticed it, right? V is validating what's valid. So being fair with yourself, but not what's not. So you don't tell yourself I'm a horrible human being for suffering this way. I'm just human for suffering like this, right? E stands for easy manner. So being kind and gentle and fair with yourself, even if you're not able to do things the way you wish to yet. And then the care, so for giving yourself the care you need, the C stands for being curious about what could really help in the situation. Of the different things I know I'm learning, I've been working towards, what could really help in this moment. A stands for, the A of care stands for acknowledging that change is hard, doing things differently is difficult. R stands for reflecting on, of the different options, which one is most likely to help me get to where I want to be. And E stands for encouraging yourself to do that thing that you've decided is probably the best thing, even and especially. So it's a triple E. So encouraging yourself even and especially when it's hard, because the reality is we all know that changing habits are hard.
Yeah.
And the last bit I'll say here to make sure people are fair with themselves is that, again, it's steps. So it's learning what you can do ahead of time, understanding that what you're doing, you don't want to anymore, getting to a place where you're going to learn something new, practicing it. And then what tends to happen is you notice first after you could have, and here's where people may shame themselves for, I knew better and I didn't, right? But actually this is an occasion to give yourself credit because, oh wait, I now know that I can do something different. That's actually an accomplishment, not a reason for shame. If that makes sense. And the same thing is true. So it's first after that you notice that it's during, but you can't do the new thing yet. Then it's before, but you can't do the new thing yet. And then it's before, and you're like, oh my God, I think this time I might actually be able to do it, right? And so it's, again, being really fair with yourself. So how do you get out of the guilt? It starts by having a fair understanding of yourself, right? That's in a relationship with yourself that is gentle, interested, validating, easy manner, curious, acknowledging, reflecting, and really encouraging yourself to, even when it's hard, to not give up and to take that step.
Beautiful, thank you. Margaret, Hugo mentioned, that I guess what I'll say is that it makes sense to me that one way to adjust this behavior, like the quick fixes that we started this discussion about, is to make self-compassion more accessible. And I think that's kind of, Hugo, what you were saying, right? Is like we need to be fair with ourselves, and we need to just like take the little steps and practice when we're not in this moment of crisis, of really, really, truly needing it. So I'm wondering, Margaret, what are some equally low effort strategies that healthcare providers could integrate into their day to practice?
No, thanks, Amy. And, I want to start, having been on the COVID and ICU units and medical floors and other places in the hospitals during the pandemic. And, what we often heard from people was, I can't take a break. I don't want to let my team down. If I take a break, then, others have to fill in for me. And that's a really hard place to be in when we feel that, if we take that time and have that self-compassion for ourselves, that we're letting others down. And I think one really simple thing that we can say to ourselves is that if we don't put the oxygen masks on ourselves, we won't be able to help others. And it often sounds like something that, we've been told for years and years and years, but it's really true. It's hard to accept sometimes, but it's true. And I think part of this is giving ourselves the permission to be able to use these strategies. I'm going to say also that often healthcare workers have a sense of duty. And duty, I think, is something I know myself I struggle with, that I have such a sense of duty that I'll work, to the point of exhaustion, or stay somewhere. I stayed in outside a hospital once for 36 hours, and I was in the storage closet most of that time, right? Not sleeping, because I just felt so strongly that I had a duty to support others. And I think that's often where we find ourselves in, as healthcare workers, is our sense of duty and our obligation, which is so important and such a valuable part of our identity, but also something that I think until we can put that oxygen mask on ourselves, it's very difficult. And so,
Sorry, Margaret, I didn't mean to cut you off. I was just wondering, actually, if you could share more about that experience, because I think that experience in the closet at the hospital, I think that is really pertinent to this conversation, right? Like what you were doing was providing a moment of respite for the healthcare providers. So I'm wondering if you could explain more about what that was and how you feel that affected the healthcare providers.
Yeah, absolutely. And so I was in the storage closet on an ICU unit, and healthcare workers don't have a lot of time, right? That's the other part of this, is Hugo and Moda were talking about, there's not a lot of time. And so how do we help people to take that pause for a moment and just either talk to someone about the experiences that they're having, or do something that can help to get them in the moment and present. And so we can think about very simple things. For example, using our senses, so our sense of touch, our sight, our sound, our smell. So one very simple thing that I do is I have worry stones. So these are worry stones. They're just simple stones that you can hold in your hand and rub your fingers on. And what that you're doing there is that you're paying attention to the sensation of the stones in your hands. You're rubbing your fingers on them. And it's just a way of simply grounding yourself in the moment. That's one very low, I would say low effort, yet high reward strategy that healthcare workers might be able to use. We call this grounding. So that notion of using your senses to help keep you in the moment. It's also that permission when you come home to say to your family, for example, I've had a really difficult day. I really need a break. Because often we come in and say, I want to make sure so-and-so is okay. I want to call so-and-so. I want to make sure everything is right for everyone else. And that's especially hard when you're a parent, right? When you come home and everybody comes to the door and they're waiting for you. But can we give ourselves permission again to take that time just to say, no distractions, no conversation. I need this moment for myself. It's also really important to think about the things that have helped us in the past. I often say mental health is not rocket science. It's actually think in the past about what's helped you. So for example, I know for me, I know when I'm overwhelmed, when I get irritable, that's a very bad sign for me if I'm irritable, because I'm not generally an irritable person. And so when that happens, I want to think about what's helped in the past. Generally, that's doing something social, having a bath, sitting down with my dog and petting her, whatever that may be. These low effort strategies, low effort are often hard because while they sound low effort, it's taking that time to give yourself permission to take that break. I know it's also allowing yourself to say, I'm not going to take an extra shift. I am going to take a day off. And again, when we have that sense of duty and obligation, which we all, I think, come to these helping professions with, be that public safety personnel, like paramedics or firefighters, and we come with that sense of duty, where we come because we want to help others. But again, we can't help others unless we're able to help ourselves and put that oxygen mask on ourselves.
Yeah, absolutely. And so one of the things that was mentioned in the talk was so many people have a hard time talking to loved ones about this experience. And actually, when I first came into this topic and I was doing research on for this very talk, I thought, you know, oh, well, that's a really good support, is talking to your loved ones. Like, how can you like engage them without burdening them? But I actually think maybe because that's so complicated from both sides of the coin, right? So my question for you, Kim, is, given that so many people have a hard time talking to their loved ones about these experiences that they've been through, what else could you recommend for like person-to-person support?
Yeah, thanks so much, Amy. That's a great question. And, you know, I think one of the things we've really learned from the research, and we talk a lot about in the interviews actually, is that healthcare providers are really, really good at taking care of others. And as we said here too, and really delivering that patient-centered care, but really struggle with turning that to themselves and taking care of themselves. And, you know, Margaret also mentioned, you know, about identity. And I think healthcare providers see themselves as they're the ones who take care of others. And that's part of the culture. And it kind of goes against the culture to turn that inwards and to start looking at themselves. So I think, you know, at work, you know, taking care of each other is important too, and supporting each other. And I think teams, you know, already do that, but, you know, it might just be recognizing your colleagues, you know, and giving them permission to take time for themselves, in addition to giving yourself permission. And I think at home, you know, as Margaret said, it, you know, I think being aware of your need to take time for yourself, I think that's, you know, the first step. But then actually being able to find a way to take that few minutes that you might need just to care for yourself is also, you know, a strategy that you could use at home.
I almost wonder, Ugo, as well. I mean, you're very expert in this. And I wonder if you'd like to talk a little bit more about grounding and some of the ways that people can use sites, rather use their senses to assist with some of this as well.
Sure, happy to. So first, I'd say you did a lovely job of describing, like, finding those things that speak to you and connecting with them, right? Because that's really at the heart of grounding is, well, there's kind of two components really, I guess. The one we're talking about there is really anchoring to the present, really helping yourself kind of, you can think of like a ship, right? We feed an anchor into the present. But it also is a pulling yourself into, like, if you think about grounding as like an image, you can be too far away from the ground, like overwhelmed, or you can be so overwhelmed you kind of collapse and feel like you're underground, right? And so grounding is the set of skills that helps you get to level ground, if that makes sense. And so sometimes that's when something reminds us of the past and we start to feel like this is like or just like the past, or it's because the present is so currently overwhelming that we're feeling overwhelmed or just so overwhelmed and flooded that we shut down and collapse. And grounding is great for any and all of those things. And yeah, lots of different ways to do it. At the heart of it is really helping yourself focus your attention on the here and now. And I would say that different strategies, different grounding strategies work differently well for different people. So to not give up if one doesn't resonate with you right away, but to know there's lots of them. And so here's just a couple ideas. The first is, Margaret, as you pointed out so beautifully, like if there's an object in particular that you find you enjoy, the sight, the touch, the feel of, right? Grounding is most effective is when we're working with what I call like grounding helpers that we find we connect with and help us just by spending time with it, we feel better, right? So like, for example, you happen to be wearing a beautiful shawl today, right? So, and I imagine it's probably soft. And so you can use that as a grounding help just to kind of notice and describe to yourself, what does this feel like? Because touch is often the fastest thing to help us with grounding. So worry stones, different textures, different temperatures, taking a sip of water, right? Or a warm beverage, something with a smell, so you can get as many of your senses as possible involved. Making sure you're breathing is a huge part of this. And so for many people, part of their grounding helper kit, they can think about that way, is scents that they enjoy, or like tea, because that way they can have the smell as they're having a nice warm beverage that's also soothing. It can be having objects that have particular personal resonance for you, or connecting with people, and especially pets. Pets can be incredibly grounding, right? And just like, as Margaret, you were talking about your dog, like, I couldn't help but smile. And that's the kind of grounding that's especially powerful, is the ones that help you feel like, oh,
Yeah.
Right? Like,
Yeah.
that's gonna be for each person is gonna be a little different, but those are the ways to reach towards, is those kinds of pieces.
Yeah, I find it really insightful the way that you all are talking. You know, I've thought a lot about grounding myself, because, you know, everyone experiences some degree of anxiety. So like, you know, for example, when I'm coming to a talk like this, I really like to engage in grounding practices before I enter the room and I'm fully present. But one thing I've never heard before is that it's really helpful in grounding to engage the senses. Like, I really think that's a really important kernel of insight for those, because I think that could, like, yeah, go ahead.
All five if you can. So the more that you can be involving, and the more you're
Right.
really connecting, and one way to connect with it is to describe it to yourself as if you
Okay.
were, as if like someone else, if they were reading it. Like, remember there's long form novels where they used to describe way too much detail? Just don't do that anymore, right? But if you were writing that so they could imagine what you're going through, because that's how you really anchor in, right? Is by the dense description, if that makes sense.
Right. Right. Yeah. I just think that's so interesting, because when I think of the techniques that I use to ground myself, they're all, like, most of them are touch, like, right? Like standing barefoot in the grass,
Mhm.
or I have a little, similar to Margaret, I have a little toy here that I play with to keep my hands busy. So I just find that the senses insight is so interesting. Moda, I'm wondering, what sort of techniques do you recommend for people, for healthcare providers, to begin engaging in self-compassion?
Yeah, well, I can kind of speak, I guess, a little bit to what we've heard from healthcare providers, to like daily things that kind of help them cope and reduce the stress from work.
Right.
So, for example, establishing daily routines was a big one, where there's adequate time for nutrition, well-balanced meals,
Mhm.
sleep, exercise, social connections. And these can be, you know, just small little daily things like, you know, meal prepping, for example, so that you don't have to worry about going home and cooking and having that additional stress for the day. You know, pets, taking the dog on a long walk in nature, practicing breathing, fresh air, sunlight, being outdoors. Even some healthcare providers describe leaving specific days set aside for leisure, things that are enjoyable to them, activities that they would have pre-planned, so they know that, you know, this day's coming up, there's something to look forward to that I'm going to enjoy on that day, and, you know, make me feel good about myself. And even, you know, integrating those daily strategies such as mindfulness or gratitude practices, you know, wake up first thing in the morning, have these little practices that, you know, Hugo and Margaret were talking about, that you can carry that self-compassion with you on throughout the day. Yeah, those are just a few things that we've heard that really work.
Wonderful. Thank you, Moda. I'm actually wondering, I'm going a little off script here, but I've got a question that I think actually might be helpful. And that I'm wondering if one of you could maybe explain what you mean by practice breathing, and really sort of like practically explain how someone might engage in that.
I think Ugo would probably be best suited to.
Okay.
Sure, Hugo.
I'll just do a quick nod to Kara in the chat, noting shaking as a grounding practice, right? Like shaking out the stuff. That's actually a really great way to, because movement is also a way of like that. In a way, it's touch in terms of like it's proprioception, right? That kind of beautiful way to ground and kind of let it all go. So thank you for sharing that, Karen. It's a beautiful suggestion. Especially if you're starting to feel shut down, right? Like starting with small movement and working into bigger movements can be really helpful. So yeah, breathing. I mean, I think a couple things. One, because again, that self-understanding leads to self-compassion to compassionate action. When we aren't breathing, and I can do this, you can hear me do this as I get talking, I get excited. And so I'm really focused on talking and not breathing, right? When we aren't breathing, a couple things happen. One, having air helps us feel safe. So when we don't have air, our body actually has a real reason to not feel safe. And we often, when we're stressed, we kind of hold our breath, waiting for the moment to pass, or we hyperventilate, right? Like, but neither one is actually getting our bodies the air it needs, right? And so our body then is like, oh, you were worried about this, but now I'm super worried about this. And then the mind gets even more worried, right?
Right, like danger.
Exactly, because it's real danger. If you're not getting the air you need, that is actual danger, right? That's clear and present danger at that point. And so having an intentional breathing practice, and there's so many different ways of doing this. So I would really encourage people to just find what resonates for them. There's so many different things to try out. Most important is to be getting good deep breaths, like breathing out longer than in helps you relax. Breathing in longer than out gives you energy. So if you're feeling overwhelmed and anxious, you would be breathing out longer. If you're feeling like I need to kind of up-regulate myself because I'm kind of shut down, you want to breathe in longer. But there's lots, you can do boxed breathing, you can do all kinds of different countings, options. The most important thing is just to make sure you are breathing and finding something that works well for you. And of course, we always have our breath with us, right? And that's the other thing I'd say about breathing. And with grounding too, you always have the ability to shake things off or to notice the textures and temperatures around you, right? Or to like notice what the different sensations are, even like on things that you wear or carry with you on a regular basis. So these are, what's wonderful about these two sets of skills is they're always available, right?
Yeah,
and
absolutely.
You have to even know that you're doing them, which is also a really important thing. If you're a healthcare provider or a human being who has a hard time giving yourself permission to do things in a way that others might see it, right? You can do grounding and breathing and no one can know that you're doing those things.
Yeah, totally. It can be just this, like, even if you're on a shift, it can be this sort of private thing that you just are standing at the monitor for a moment and taking a second for yourself. Yeah, wonderful. Hugo, I'm wondering, I know you work with folks who deal with occupational stress in your work as a clinical psychologist at the trauma unit at Homewood. So could you share a bit about what you've observed about your patients over the course of the pandemic?
So this is a really good question and also one that makes me sad at two different levels. So the first one is that I think, as a number of us have talked about, because of the ways that people tend to relate to themselves when they're drawn to helping professions, which is that they're very focused on giving and caring for others rather than themselves. So the first observation is that a lot of the people that we would expect to see coming in to get help aren't, and it makes so much sense, right? Because people feel that this is what I need to be doing this work. There's no time to take care of myself. And so I think, so to the first point there, it makes a lot of sense to me that people who might really benefit aren't able to allow themselves to give themselves permission to give themselves the care they need, right? And so my hope is that they do find a way to give themselves that permission when they really need it, in terms of reaching out for local support, reaching out for outpatient support if that's available to you. I know a lot of people have work-related support available, and if not, to really encourage your system to support that. And or to come in once you feel like you can do that, right? All of those things, if coming inpatient is helpful, if not outpatient, all those pieces, right? And also meditation, yoga, whatever speaks to you, but making sure you're giving yourself the care that you need and not ignoring your needs. In terms of the people that have come in during the pandemic, especially healthcare workers, all the themes we've just talked about just resonate so deeply. And what I would say with great gratitude to everyone on this call is for all the work they have done, And then for the researchers on this call, for the beautiful work they've done in helping understand healthcare workers' experiences, because that's helped us as providers be of better support so that we know what people are going throughout the healthcare pandemic and the healthcare challenges for healthcare workers, so that we can respond in a way that is, again, more understanding, so therefore more compassionate, which can hopefully facilitate more compassionate action. But yeah, it has been heartbreaking because this has been so hard for so many people who just often feel no one does understand, because mostly they can't, because they aren't there, right? And one other thing to be aware of is that trauma and dissociation are tightly linked. So if it's too much to think about, we disconnect from it, we dissociate from it. And so people who aren't exposed to this level of distress, it's hard for them to think about it because our brains don't want to be connected to distress, right? Because it's overwhelming, so our brains start to shut down. And that then makes it harder for people to then speak to people, because they can tell that others either don't understand it or aren't able to stay engaged when they talk about it.
Right. Yeah.
And so the more
Yeah.
they allow themselves
Go
to get
ahead.
help, the more they can allow themselves to get help from people who are trained to be able to remain present during those kinds of pieces, I think the more helpful that can be.
Yeah, and that's really pertinent to the part where I was mentioning about the talking to the loved ones, right? Is that like it's not necessarily
No, they don't care. They just can't. They can't do it.
Right.
Yeah.
They can't process it. They can't
Mhm.
really understand it because they haven't been, like you said, exposed to that level of stress.
Mhm.
And I just wanted to sort of, Margaret, I wanted to pass to you, because you had mentioned earlier a bit about, and I think this is relates to what Hugo was just saying, is that you mentioned a bit about the relationship between sense of duty and self-compassion. And I'm wondering if you could just dig into that. I don't have a specific question, but I feel it's important because sense of duty, I'm sure, resonates with many in the audience. So I'm just wondering if you can speak more about, even when you were on the front lines there, how that relationship is and what we can do to sort of turn towards self-compassion in that manner.
See me, and it is as you say, it's a difficult one to pull apart, right? So I think again, we come into these helping professions because we want to help, and our identity, as Kim was saying, really becomes we're a helper, right? That we are here and we're making these sacrifices. And I think many of us believe in service, that we're here to serve. And therefore that service is the work that we're doing. And in order to serve, we also have to be healthy ourselves, right? Or as healthy as we can be. And many of us will, I've struggled with depression and PTSD, and I talk very openly about that. I think it's really important. But I have to see that to help others, I also need to have self-compassion towards myself. I give myself the space and the time to do things that will help me to be healthy. I will be really upfront and say I find that very difficult. I will be very upfront about that as in the many roles that I have, it's hard, right? But I think part of it is that we also have a duty to ourselves, right? So we are the vessels of our own identity, and we have to care for ourselves too, to be able to perform our duty. But also we have a duty of care to ourselves. We owe it to ourselves to take care of us.
Mm-hmm. Absolutely. Thank you. Margaret, I just have one final question. It is also for you. And that is that I can't help feel like, we're talking about self-care and that's so valuable. But I can't help but feel like some of the circumstances that have led to this very webinar are systemic. It feels like it needs to be about culture change within the healthcare industry as well. So Margaret, I'm curious how organizations, even though they're also, everyone's stretched to the limits, including the organizations, but how can they help healthcare providers right now?
Great question. Thank you, Amy. And I think part of it is seeing our common humanity. So I think healthcare organizations are often very hierarchically structured. So there's sort of the view that we have, those at the top and those on the front lines, and there's a lot of hierarchy in that. And I think part of what we need to do is be able to see each other as equals, that we care for one another, that our first duty is one of care and not of, this must be done this way. We're in a very unique circumstance right now. And I think we need to acknowledge that and again, see everyone's humanity. I think we need to check in with people and see how they're doing. So it's really helpful. When I was out on the on the front lines. You know, a lot of managers would talk about, I have people come into my office and I talk to them about how they're doing. I get to know them personally. I speak to them about, you know, what do you need in order to be able to do your job? We need to ask our teams that same question. So, you know, what is it that you need? We can't respond to every need, but we can at least hear about what are some of the needs that you have. And you know, managers, directors, and leaders also struggle, and we need to provide support and compassion for them as well. But I think part of this is a bit of leveling the playing field and allowing us to see each other as humans who all have needs and identity. And how do we support one another in this, because we're all in this together.
Absolutely. Thank you. And I think that's a beautiful note to end our discussion today on. So thank you so much to all of the panelists for participating today. I just want to say that over the weekend, I had to take a trip to the ER with my youngest daughter, who's 4. Everything's fine, don't worry. But it was the first time that I've set foot in a hospital since the pandemic, which I consider myself very fortunate for that to have been my case. But when I walked in, everything looked different. There were dividers in the between the waiting room chairs, and there were nurses in, you know, the full PPE. And for me, knowing that this webinar was coming up, it was really like stepping into this world that you've all been living in for 2+ years. And I have to say, like everyone, every single nurse, doctor, healthcare provider that we spoke to was so kind to my daughter, who was very scared. And so I just wanted to say, you know, I see you all in the audience, and thank you so much for showing up every day and doing what you do. It's so important. It's so important. And if there's one thing that you deserve, it's compassion from the public, but also from yourselves. So that's it for me today. But before I pass it over to Margaret to close out, I'd just like to also thank our sponsor once more. So thank you to the Public Health Agency of Canada for supporting this important work. We appreciate you. And Margaret, I'd love to pass it to you for some final words.
Thanks, Amy. And thank you for sharing that experience. And I think what we have seen over the course of the pandemic is, unfortunately, there has been a real rise in incivility and violence towards healthcare workers. I think it's really important that we acknowledge that. And we know that healthcare workers are facing that. And, you know, I think what you've done right now is exactly what people need to hear, that we see you, we appreciate you, we know your service and your sacrifices, and we know your stories. And so I think that's how I think we'd all like to end the symposium, is to say thank you to the healthcare workers and public safety personnel and other people at the front lines of this pandemic. Thank you for your service. Thank you for your sacrifice. And let's all give ourselves a bit of air to allow ourselves just to breathe and be present, and to give ourselves that self-compassion that everyone here needs. So thank you very much.
Thank you all. And thank you all for joining us today. And I hope you have a wonderful rest of your day. Take care.